want to thank Linda again for asking me to speak to this group of patients and people who are also involved in treating the disease. I'd also like to say that if I ever got sick, I'd like to go out to Libby, Montana, because what an incredible group of people, really. Starting with the diagnosis, I find that most people first start out with shock, and then there's paralysis, and they need to start to move forward. It's anger at the disease. It's the fear of what this disease is going to do to us. We have to sort of mobilize our forces at this point. If you've had major surgery, they say, take 6 months, don't make any decisions. You get this diagnosis and you're told you've got to start making some decisions, start seeing some people, and start moving forward and trying to get treated. So you look for consults and you look for second opinions. So where do you go and how do you find them? Most people go on the web and they look to see who are the experts in the field. And I find that people go in one or two directions. Usually they go and they see, two oncologists to get the opinions. They find someone that they share something in common with, that they feel they're going to take care of them, and they settle on being treated by that physician. But I also find that there's a lot of mistakes being made by some people who really, when they go out for a second opinion, they're looking to find somebody who's going to agree with what they want to do. So instead of really accessing the knowledge that these physicians have, they go in with sort of a predetermined idea of what it is they're looking for. And I've seen, as I said, mistakes made where people really do not take the expert guidance, and when by the time they come to the realization that they've missed it, it may be too late. Once you get the information, you have to sort of sit down and synthesize and realize that no matter how much information you've garnered and how much information you've gotten from the web and the physicians, you still have to realize that you're going to see experts. They treat this disease, they know this disease, and you're going to have to put some faith and some confidence and allow them to sort of lead you down the pathway of what treatments you should try and the order maybe that they should be lined up in. And then you need to decide on the active treatment. Also for a second opinion, to remember that a second opinion is really just that. That's the person you've gone to. He's given you an opinion, but he's not going to be your treating therapist. So it's not going to be the person that you're going to be able to call on every 3 or 4 weeks. You've gotten your opinion, you've gone back to the person now that you're working with, and basically the responsibility of getting you through the treatment and side effects will be that person. You need to be in touch with your internist, especially in the day of managed care where you need to get referrals for CT scans, for all kinds of regular exams and checkups. If you have a flu and a virus and your oncologist is away, his covering oncologist is not going to want to take care of somebody with the flu. So you really do need to keep touch with somebody who's known you and knows you for a long time. The oncology social worker is someone that you should make an appointment with as soon as you can because they really have a wealth of information. And I say they hold the key to the finances also. They know what money's out there to help you if you're having difficulty paying for the medications, for the treatment, for travel, et cetera. Once you start the treatment, you'll ask for a calendar so so you can schedule your regular life and you can schedule things around the visits. You want to find out if I have side effects, who do I call? Do I call the nurse? Do I call the doctor? If it's after hours, who do I reach? Who are the covering doctors? And what information do I need to give them? Because sometimes we assume that when we call a covering doctor, they know the disease, and in many cases they don't. There's usually an expert in meso, but his other covering oncologists may not be experts in the disease and may not be as familiar with your treatment. So you want to really keep a list of the medications you're on. You make a treatment diary. Keep track of what's happening while you're having the treatment so you can plan your life accordingly. Sometimes for the first week after treatment, you're feeling rather good. That's when you'd make plans to go out for dinner and to continue with your life. You want to take care of dental needs close to your appointment because this way, if your counts are low, you're more apt to have an infection or a bleeding problem. So, take care of all the healthcare needs that you need to take care of prior to starting if possible. It's the decision of the patient whether they want to continue with treatment and what the goals should be. You want to speak to your doctor, is this palliative, is this curative? I'm having symptoms, will this treatment help with my symptoms? Find out what the expectations are. And these expectations also change over time, so if you're having second thoughts about the treatment, make sure that you do bring them up with the doctor and the healthcare team. And for family members, I think it's important to stress that you don't want to undermine the relationship between the physician and the patient. And by that I mean so many people will take us aside and say, well, what's the real story? Talk to us. Please don't tell him. And what happens then, the patient really loses a sense of trust. I think that the communication always has to be open between the medical team and the patient, and that the patient knows that what I know, he knows. And this way, when we're in a crisis situation, he knows he can trust me to really give him the truth. Marriages are greatly affected by this. It's almost like having the death of a spouse. I mean, your whole marriage changes. This, everybody has different roles. You look at what the roles were before the diagnosis, and you try to see, are you going to be able to keep up with bill paying, with this, with that, and you try to just redefine and, slowly start to make changes as to how you're going to handle, your relationship. I always tell the wives and husbands that, you want to have a medical person be the medical person, and you want to be the spouse, because the relationship is so important, and the love and caring that you exchange needs to continue to be on that level. You need to talk about short-term planning, long-term planning. If you have children, if you have elderly parents, life goes on despite the disease. The community members and family members want to help, and so many times I hear patients say, I don't want to burden my children. But children, they really don't consider it a burden. There's not much they can do for you. So if you can ask them to do something concrete, you're allowing them to express their love. So let the children be involved and let your friends be involved. When people ask what they can do, don't shrug your shoulders. Tell them, it's the day of treatment. It's really hard for me to get home. Maybe that day they could make dinner for you. Somebody can go to the store, pick up dry cleaning. Give them definite things to do. You sit down and really look at your finances. How is this going to impact? You may not be able to afford a lot of the things that you had been doing in the past, because all of these visits there is some out-of-pocket expense. I know in New York, parking alone is $20 for just the first couple of hours at the doctor's. You want to identify a case manager at the insurance company. That's somebody who should be working as your advocate. So if you need CT scans, or you need to see another doctor, or you need to see a surgeon, this is the person who really is going to be making that decision, or bringing it to the medical monitor there to get the decision moved quickly along. I've had people who've been vomiting from chemotherapy, and I've spoken to the insurance company, and they said, well, we'll let you know on Monday. This is Friday. And I've said, my patient has to vomit for the weekend? So if you have a case manager, I have a person who knows you that I can call, and they're already familiar with your disease, your treatment, and they've worked with us in the past. Social needs, you want to look at, what did you do as a couple? What did you do as a family prior to the diagnosis? Can you still do some of these activities? How can you establish a sense of rhythm and structure in your life? Your friends that were friends before this disease, allow them to still be part of you. Don't push people away. Keep people coming for dinner. I find that patients, it's really hard to keep an appetite. It's hard to keep up with all of this going on. But if you have somebody at the table, that person who's ill is going to rise to occasion and sit there and try to eat, and you'll find you'll be helping everybody. Respite care, the caregiver definitely needs to have a break. You're with your partner 24 hours a day. You become so close to the disease sometimes, it's really hard to take a step back and really assess what's happening. So I find that if you can get some respite care, have someone come in, maybe stay with your partner for a few hours, go out, get a manicure, go for a walk, go to the movies, anything to sort of relieve some of the stress that you've been under. Take a class, join a group activity. Vacations, there's no reason to believe why patients, even with this disease and treatment, can't go on vacation. So we always discuss that with the patients, especially when we're talking about chemotherapy that's not curative. It means that we do have the opportunity to stress the time sometimes between treatments. So if you tell me that you want to go on a vacation, we'll make sure that we arrange the treatments in such a manner that you should be at the high time with your counts, et cetera, that you can still do some traveling. Advanced directives, we see this every time you walk in a hospital now, you see the signs for advanced directives, but it's surprising how many people don't have these instructions in place. You really need to have a good discussion with your family members, and that's not just your wife and your children, but if there's a step family, everyone needs to be aware of what your wishes are, because you really don't want the fallout when people are under a great deal of stress. It becomes the most difficult time to make decisions if we don't know what your wishes were. Clergy are very happy to get involved if you're not sure based on your religious beliefs, some of the end-of-life decisions with DNR orders, et cetera. And if you really are having difficulties and you're in the hospital, they usually have medical ethicists that can be brought into the discussion if there are problems with family members and everyone is not on the same page. And you want to start to look at home versus hospice programs also. In terms of conversation, I think it's very important that we're open and we really discuss what's going on. Again, it's, people assume that, the person who's ill doesn't realize that when things are going sour, and in most cases they do, but it becomes this open secret. And what happens is people then are not really allowed to express their feelings. And even if you can just open the door by saying, I really am frightened, I'm scared about what's happening to you and to us, that allows this person to start the conversation with you to let you know whether they are in psychological or emotional pain and what you can do to sort of reach out and help. If you have young children, again, you want to find out, what the kids are thinking. We tend to whisper around the children or get onto these hush voices on the phone, and kids have great imaginations, and sometimes what they're imagining is worse than what the reality of the situation is. You want to, at the minute, there is a diagnosis like this, you want to speak to either a guidance counselor, a nurse, trusted leader in the community that the child might have a relationship with, a teacher, or with the pediatrician. And you want to encourage the children to share their thoughts. And many times I tell my patients, bring the kids to meet us, because I think sometimes it gives the children a level of confidence and comfort too once they've met some of the members of the team. Financial settlement, as you know, with mesothelioma, there's, many patients will get, settlements. So you want to make sure that you keep your wills up to date. And when there's so many people in a family involved, many conflicts surface. And the reason to have a will is really to protect those that you love with thoughtful thoughts and a detailed will. The future, I tell everyone, plan for a future. I mean, there are so many patients. I have patients that are alive 9 and 10 years with this disease. You're always looking over your shoulder waiting for the ball to drop again, but there is a chance for a future. And don't allow people to write you off. Many times you need other medical procedures and the doctor says, he's got a diagnosis of mesothelioma, why should we? They're not really that educated that people do live for long times with this disease, and sometimes the concurrent medical problems can greatly impact. And listen and choose wisely and find a healthcare team that you can trust. Work at Columbia University. I just wanted to mention I work with Dr. Robert Taub, and we've just hired a new physician assistant, Alethea Hare, who'll be replacing me at Columbia. Dr. John Chabot is our surgeon, and Nicole Getz is his nurse practitioner that works with surgeons. Thank you.